Hi, this video is going to be discussing whether or not it's beneficial to tell a child that they're autistic, and also we'll be discussing the pros and cons of disclosure more generally. Um, so most of the time, the answer to this question is that it's best to tell a child they're autistic as soon as possible. One research study looked at the experiences of 78 autistic adults and found that those who were identified as autistic earlier in life and told that they were autistic had a better quality of life and a higher well-being overall going into adulthood than those who did not know that they were autistic until later in life. Um, and I think that another strong motivation for telling someone they're autistic as soon as possible is ironically related to the reason that a lot of parents don't want to tell their child that they're autistic or are worried about it. So I think the most common concern that comes up would be parents who are hoping that not telling their child that they're autistic might spare the child from the discrimination or social isolation that autistic individuals often experience. And they might also hope that if they don't tell the child they're autistic, that the child won't feel different or won't feel isolated. And also that the child might not be labeled as different or discriminated against by others without that label. Um, from my personal perspective, I think that um, children are often going to know that they're different, regardless of whether you tell them they're autistic or not. But without having a clear label that can provide a source of understanding and even appreciation for the way that they may experience the world differently, children might come up with their own explanations, which could be a lot um, more difficult. They might assume that they're broken. They might assume that there's something wrong with them. They might just feel a lot of guilt and shame for communicating differently. Maybe if they're young, like playing differently, finding more joy in routine, finding more distress if routines change, and not being able to understand why that is. Um, Likewise, I think that even if those around the child don't know that the child is autistic, they will still almost certainly be observing autistic traits and can unfortunately still apply stigma to those autistic traits. A child who has sensory processing differences, for example, might be perceived as overly fussy or overly dramatic. Um, a child who really likes routine and finds it distressing if the routine suddenly changes can be described as overly fixated, inflexible, rigid, etc., demanding. I think for social differences in particular, there's all kinds of really negative words that people can apply, and that I think many of us who realize we were autistic later in life have definitely experienced, like weird, awkward, um, etc. And a label isn't going to fix all of this. People can still apply stigma with the label of autism, and unfortunately frequently do. But in some cases, it can actually lead to more understanding and more of a framework that leads to accommodations. So instead of a child needing to mention that they are, for example, sensitive to this light, sensitive to that sound, that they find it stressful if this routine is interrupted, sometimes an autism label can provide an approximate outline for those differences and give teachers a starting point to understand the child. And can sometimes also prompt teachers to realize that it would be beneficial to have this discussion in advance rather than needing to kind of go through this long sequence of discussing individual traits as they come up and are relevant. So there can be that element of simplicity and proactivity that can be beneficial. Um, Unfortunately, and I wish this wasn't the case, but practically it does seem to be, disclosing that you're autistic can sometimes make accommodation needs also be taken more seriously, both in a formal setting, like in a classroom where accommodations might be formally granted through an IEP process, but also even just socially. I've heard from autistic friends that they might have had a specific sensory need that no one really took that seriously or just assumed that they were being um, over the top about until they shared that they were autistic and it's related to their sensory processing differences. And then those around them, in some cases, did start to take it a lot more seriously and started to recognize it as more of a legitimate need. So I think given these practicalities, disclosure of a child's autism, both to the child themselves and assuming that the child is too young to communicate their preferences, and so the parent has to make the decision on their own, to those around them like teachers, friends, etc., can often be really beneficial. With that said, I think it is important to discuss the drawbacks because nothing is ever completely clear cut. I think maybe the first question that would come up under this category is, are there exceptions to this general rule? Are there ever cases where it would not be beneficial to tell a child that they're autistic? And there may be some cases that I'm not thinking of right now, but the one that does tentatively come to mind would be if a child has generally communicated that they're not really interested in exploring their social differences or their sensory differences, if they, certainly if they seem to really dislike labels in general, if they have not found other mental health labels or labels related to neurodivergence helpful, those could all be indications that, providing another label might also not be that useful. It could still be worth providing information about autism in general, because whether or not the child decides they're autistic or not, whether that fits them or not, it's still good to learn about the autistic community, even so, just so they can support others who are autistic. But in that case, it might not be worth pushing for a diagnosis, or if the child has been diagnosed at a much earlier age and just hasn't been told of it yet, it might not be good to tell them at this point. It might be best to wait until they seem at least somewhat curious about the topic or seem to be indicating that it would actually be helpful information for them to know. I think another drawback, the other drawbacks I think are mostly about whether it's helpful to tell other people. This I think is going to depend quite a bit on the circumstance. If someone clearly has a lot of specific stereotypes about autism that you feel might really affect the way that they view your child, in that case, it could be unfortunately best to just not say anything. I think one particularly interesting part of the study mentioned earlier that found that knowing you're autistic early on leads to better quality of life and better well-being is that they also found that those who knew they were autistic only later in life seemed to experience more positive feelings towards the label of autism and experience more relief when they found out that they were autistic. And in my mind, this points to maybe a broader idea that people benefit when we have autonomy over how we can describe ourselves. For those who are diagnosed earlier in life, they may have often experienced being labeled as autistic, even in situations where that's not something they would have chosen to disclose. Or maybe just having that label be applied to them in every situation, or having that be the first thing that someone sees about them, or one of the first things that someone sees about them in many situations. Whereas those who are identified later in adulthood may have experienced years and years of not having any understanding or any label for that understanding, and may be really eager and relieved to finally have access to that label and to be able to use it as a tool to explain ourselves. So this, I guess this to me does indicate that it might just be good to sort of on average keep track of how frequently you are disclosing that a child is autistic. I don't think there's a general correct percentage. It's probably going to depend on a lot of factors. And I think it will also depend on the environment, the way that the child presents their autistic traits. If you don't disclose they're autistic, are they likely to be, even in a brief interaction, stigmatized as being a bad child, or to have people kind of constantly trying to guess what their neurotype may be? In that case, I think sometimes just starting with the label upfront can be beneficial. But where possible, maybe to see if there's ways to have situations where it isn't brought to the forefront immediately, and then also to be sure that there's situations where the label is used and where the child knows that it's not something that they have to feel ashamed about, or that stigmatized that they have to hide, etc. I think the last main drawback of sometimes using labels is that people can be, even with the best of intentions, with the most supportive intentions, can have this sort of autism basket in their mind. That's probably not the official term for it, but where they keep all the autistic people that they've met. And if they've worked with, say, two autistic children closely before, or even just one autistic child closely before, if they hear that your child's autistic, they might immediately start assuming that they'll be exactly like whatever other autistic child they've met is. And so in that case, autism may be, it can sometimes be a shorthand for getting certain needs recognized, but it can also lead to this expectation that the child will have the exact same needs and will react the same way. It can sometimes lead the child's individual needs and preferences and communication to be overlooked. And so, unfortunately, I think the question of when to disclose to other people is a lot messier, especially in more isolated instances or social settings. I do definitely think that in educational settings, it's very much beneficial overall. And I believe that most schools also require that currently, or ask whether a child has any diagnosis going in. But those are just some, this is a little bit less organized than some of the other videos. And I think that that also just reflects that there isn't as clear cut of an answer, but I hope that this provides a helpful starting point for thinking about the topic.